Good afternoon. My name is Jasmine Dudley. I am a social worker with the Clay County Social Work Association, and I will be doing a biopsychosocial with you. What is your name, sir?
My name is Joseph Hamden.
Okay, Mr. Hamden. A biopsychosocial assessment is an assessment that identifies biological, sociological, and social factors in your life to help us identify any barriers to treatment that you may have. Anything that you say today is confidential. However, if there's immediate threat to danger to yourself or someone else, I will have to report that. Do you understand that?
Yes.
You do?
Yes.
Okay, thank you. Would you like to proceed with the evaluation?
Yes.
Okay, sir. Would you please tell me your circumstances of admission?
I was out drinking with friends.
Okay.
And I asked them how they feel if I was no longer here.
Okay.
And they called 911 on me.
Okay, and what happened when the police arrived?
They said my friends feared for my safety and they would have to take me in for an evaluation.
Okay. Do you have any previous psychiatric history?
If you call it that, yes.
Okay. Was it inpatient or outpatient?
It was inpatient.
Inpatient, okay. And where were you when this happened?
Fort Knox, Kentucky.
Okay. And how long ago was that?
10 years ago.
Okay. And what was the circumstances of that admission?
They diagnosed me with PTSD.
Okay. Was alcohol involved at that time?
They said it was.
They said it was. Okay. And do you have any outpatient history? Do you currently see any social workers or counselors or therapists or anything?
No.
Okay. Do you have any history of ECT, electrical shock therapy?
None.
None? Okay. What is your family psychiatric history?
I don't know.
You don't know. Okay. What is your relationship status?
What do you mean?
Are you married, never been married, divorced, widowed,
I haven't seen her in 10 years.
Okay, but was she your wife?
Yes.
Did you officially get divorced?
No.
Okay, so you're still considered married, however, estranged relationship. Okay. What is your current living situation? Do you live alone? Do you live with family or friends?
I live alone.
Live alone. Do you live in an apartment or a house or some type of...
A fifth wheel.
A fifth wheel.
I don't like being stable too long.
Okay, so like an RV.
Yes.
Okay. Do you have any family or friends that you would like to include in your discharge planning?
No.
No. Okay.
They sent me here. Why would I want to talk to them again?
Okay, I understand. Do you have any children?
Yes.
How many?
4.
4. And what are their ages?
23. 18. 13. 7.
Okay. And do they reside with you or with their mother?
With their mother.
Okay. What is your sexual orientation?
Heterosexual.
Heterosexual. Okay. And do you have any education past high school?
Yes.
Okay. What education do you have past high school?
I have college.
College? Did you complete your degree or just some college credits?
I completed.
Okay. Bachelor's. And what is your degree in, if you don't mind me asking?
Criminal justice.
Okay. Are you currently employed?
No.
You are unemployed. Do you have income?
Yes.
Okay. What type of income do you have?
Military retirement.
Okay. So the military history is yes. Do you have combat history?
Yes.
Yes. What branch?
It's only one. Army.
The Army. Okay. And how many years?
20 something.
And did you have an honorable discharge?
Yes.
Do you currently receive any disability from the military?
No.
No, just your retirement check. Okay.
They need to hurry up though.
Okay. So you're still waiting on that information?
Yes.
Okay. Do you have any spiritual beliefs that you would like to share?
No.
No.
Just spiritual.
Just spiritual. Okay. So no religious affiliation.
No.
Okay. Would you say that you are active or non-active?
Active.
Okay. Do you speak any other language besides English?
No. How long is this going to take me?
It takes about 10 minutes or so to get all of our information. We just want to ensure that there are no barriers to treatment for you. So once you leave and we get you set up with your psychologist, that you'll be able to continue your treatment. Yes, sir. Do you have any legal involvement?
No.
No legal history. All right. Now, this is going to be a substance abuse report. Have you ever been on anything besides alcohol?
No.
No. Okay.
Just the pain pills the army give you.
Just the pain pills. But were you addicted to those, but just use them in like after
as
procedures
needed.
or as needed? Okay. So, what was the first use of alcohol? At what age did you first use alcohol?
16.
16. Okay. And at what age did you become a regular user of alcohol?
20, 21.
Okay. In the last month prior to admission, how much alcohol a day would you say you consumed?
2 to 3.
2 to 3 drinks?
Mm-hmm.
Okay. What about in the last 48 hours prior to admission?
I don't remember we were having shots, so.
And what would you say your use pattern was? Would you say that you are a daily user or social user?
I'm more of a social user now. I used to be a daily.
Okay. Okay, so we're just gonna and you're denying any heroin usage or any other type cocaine,
Nope.
any other methamphetamines or anything?
No, none of that.
Okay. And your primary drug of choice is alcohol, correct?
I don't call it a drug.
Okay, so your primary substance is alcohol?
Yes.
Okay. And there is no secondary use, so we're just going to put not applicable, correct?
That's correct.
Okay. So when you do not have alcohol, do you experience any type of withdrawal type symptoms? I'm going to go through a list and just check off if anything applies. Just nod or say yes. If not, then we'll move on, okay?
Right.
Cravings?
Sometimes.
Sometimes, okay. Itching?
No.
Tremors?
No.
Blackouts?
Only when I drink too much.
Okay. Guilt associated with use?
No.
Preoccupation?
No.
Compulsive use?
Used to.
Okay. Mood swings?
Yes.
Nosebleeds?
No.
Sinus problems?
Yes.
Chest pain?
Yes.
Increased tolerance?
Yes.
Nausea or vomiting?
That's for wimps.
Okay. Loss of control once started?
No.
Seizures?
No.
Failed attempts at control?
No.
Use upon awakening?
In the past.
Okay. Paranoia?
Yes.
Palpitations?
Yes.
Decline in hygiene?
No.
Okay. Loss of sensation in extremities and numbness? Continued use despite negative consequences?
Yes.
Abusive behavior towards others?
Yes.
Withdrawal signs after the last use?
No.
And annoyed with others who complain about your use?
Yes.
All right.
Why'd you check that other one?
Withdrawal. Well, since you've been here in the hospital and you haven't had any alcohol in the past 48 hours, have you felt shaky or dizzy or any type of signs of withdrawal?
No.
Okay. Would you say that you have a great perception into your alcohol use?
Yes.
Can you describe what that means, your perception of your usage?
I know when to stop and when to keep going.
Okay.
Others may feel like I should stop, but I know I can keep going, so I do.
Okay. What is your family's perception of your alcohol use?
My kids want me to stop.
Okay. What is your longest period of abstinence?
8 months.
Okay. Were you going to any type of treatment or AA meetings
No.
or anything? You just decided upon yourself to stop?
Yes.
Okay. When did this occur?
5 years ago.
Do you have any factors that was contributing to your abstinence? What was helping you to stay abstinent for those 8 months?
I was going to have kidney failure.
Okay. So for health risk, okay. Okay. Have you ever had any previous substance abuse treatment?
No.
NA, that's not applicable. Do you have any problems with betting money, lottery tickets, or gambling?
No.
No, okay. Do you have any history of self-help groups, so any AA meetings or anything like that? None, okay. And we've already talked about your finances. You've got your military retirement. How much would you say that a monthly amount is?
$2,700.
$2,700, okay. And after you've paid all of your living expenses and everything, do you have any money left over at the end of the month?
Yes.
Okay, about how much?
$100.
About $100, okay. Alright, that's for you to fill in. I would say you have good insight into your situation. Would you feel like you have good impulse control?
Yes.
Okay. Do you have any memory problems?
Yes.
You do. Short term or long term?
Both.
Both. Okay. Do you know at what age this began?
I don't know. I'm unsure.
Okay. Are you currently having any suicidal ideations?
No.
No. Did you have a plan when you were admitted?
A plan for what?
A suicide plan?
No, because I would never kill myself. I can kill other people, but not myself.
Okay. So do you currently have any homicidal ideations?
No.
No? Okay. Do you have weapons?
Yes.
Okay. What weapons do you have?
Firearms.
Okay.
Knives.
Now, do you have anyone that you would trust with your firearms and knives if that was going to hinder your release from here?
No.
Okay. Let's see. Okay, sir, your transportation, how will you get back home once you're discharged?
I'm going to make them come pick me up.
Okay. And when you say them, you mean your friends?
Yes.
Okay. The ones that called on your behalf?
Yes.
Okay. Will you return to your previous living arrangements upon discharge?
Yes.
Okay. Your living arrangements? Yes. For me? No. You have an education, so that's yes. There are no legal concerns. No. Financial concerns. Yes. Healthcare. Do you currently have healthcare?
Yes.
Okay. Yes. Safety plan. All right, sir. Those are all the questions that I have for you. Do you have any questions for me?
When can I go home?
Well, as soon as we process your biopsychosocial assessment and assess any barriers that you may have to treatment, and we get your safety plan solidified, at that point, if the doctors decide that you have been stabilized, you'll be able to go home.
Okay.
Okay?
Right.
Thank you for your time.
Thank you.
I can't reach it.